Okay, here we go. So, um, our me and Gabby's ergogenic aid is cupping, and so cupping is a traditional Chinese medicine therapy, which dates back at least 2,000 years. But you can find it in a lot of different ancient history therapies, like from all over the world. And so, um, to cup and knowing how to cup, um, first it's making like a suction or a vacuum with small cups using fire to create the suction. So you have a stick with a cotton swab with alcohol on it, and you light it on fire and you stick it in and then out of the cup, and then you put it on um, the part of the body. But nowadays, just like the picture at the bottom, there are devices that will make the suction without fire. And then the suction in the cup is supposed to be placed on the part of the body that is bothering you, and that will create the therapeutic functions. And then there are also a lot of different types of cupping. There's flash cupping, moving cupping, or massage cupping, wet cupping, and needle cupping.
Okay, so when cupping first started in China, when it was first invented, the use or like the reason for it was because they believed that it would cause a balance between positive and negative forces in the body. But now that's not really the reason we do it. So with cupping therapy, the cups create a suction. So they cause healing through blood flow. So it'll ease muscle soreness, aches, and pains. The major uses for cupping are pain reduction and muscle relaxation. So it is used by people with back, neck, knee, and shoulder pains. And a lot of athletes will use it for both injury prevention and relief. And it can also be used for headaches. I feel like it got more popular in the 2016 Olympics when Michael Phelps was seen with the big like dots and bruises all over him. So that was when I first heard about what cupping was, and it just shows how it was very popular among athletes to help relieve the tension in the muscles. There's also different theories associated with cupping, such as the blood detoxification theory, which suggests that cupping releases toxins and removes wastes and heavy metals from the blood. And then the pain gate theory is another one that states that cupping stimulates pain receptors, which will lead to increased amount of impulses, which closes pain gates and reduces pain.
And some research on cupping about how effective it is. So I found two articles that were pretty interesting and are very different from one another that show how cupping works. Um, and so the first uh, study that I found was um, if cupping is more effective on low back pain than typical care. So there were patients that were split into a cupping group and a group who went through their usual care of um, to treat their low back pain. And so they went through their treatment. The cupping group went through wet cupping, which is where you puncture um, where you're cupping, and then the blood and toxins come out into the cup. Um, and then they were assessed before their treatment and 3 months after their treatment. And the results from that study were that the patients who went through cupping um, had a decrease in pain intensity, pain related disability, and medication use after their 3 months of using cupping. And the group who went through their usual typical care to treat their low back pain had no change in any of those. And then the second article that I found was um, how effective dry cupping on the wrist um, and how that affects post-operative nausea and vomiting. So the patients from a hospital who were going through their gallbladder surgery were split up into a cupping group and a sham cupping group. So each group didn't know whether or not they were going to receive actual cupping or if they were not going to receive cupping. And they were evaluated 2 hours, 6 hours, and 24 hours after their surgery to determine if they were feeling nausea or vomiting after the surgery. And so the results from that study were that the cupping group um, uh, showed a lot less post-operative nausea and vomiting than the people who did not receive their cupping.
So cupping's different from other ergogenic aids we kind of talk about because it's not exactly used by athletes to get ahead in terms of exercise and stuff. It's more of a pain relief. So it's generally regarded as a safe way to relieve pain. Um, if it's done by a professional and they understand that the patient understands that there will be side effects like bruising and stuff, it's not exactly like a legal thing. It's not something that would be illegal in terms of Olympics and stuff like that because it's more of just a pain relief and not for getting ahead. So as long as it's done in a sterile environment and by a professional that kind of knows what they're doing and how to keep them safe, it's pretty safe and there's no legal issues with it.
And for the recommended dosing of cupping, since there are different types of cupping and techniques, each one has different timing and intensity, but most of the techniques can be done at all of these intensities. So first, light cupping, which the pressure inside the cup is 100 to 300 millibar, which is the atmospheric pressure inside the cup. And this is for normally places like your face where that's more sensitive. And that an example would be flash cupping, where you're cupping for like 2 seconds and then removing and then cupping again. And then medium cupping, where the pressure inside is 300 to 500. An example of that would be moving cupping or wet cupping. Um, and then there's strong cupping, where the pressure inside the cup is above 500. And so the suction of strong cupping is really intense, and it needs special care. An example of that would be dry cupping. Um, but strong cupping, since it's so intense, you need to be able to um, have special care to reduce the risk of any injuries. But the general timing of having cupping done is between 5 to 20 minutes.
Cupping therapy generally doesn't have huge risks associated with it. After treatment, there will be the large reddish circles that will be apparent, and they'll exist for a few days after or up to a week. So you can see, like you've seen in pictures, like the one I showed of Michael Phelps, like wherever the treatment takes place, obviously the cups, because of the suctioning, will cause these kind of bruises to appear. Some people can have burns from the cups, which is uncommon, but it does happen sometimes. And though I may have pain and discomfort during the treatment and for a few days after, um, fatigue and dizziness can occur shortly after treatment, but again, it's not a common side effect. An infection can also occur from wet cupping, but it's also uncommon. This is a relatively safe therapy treatment. And if it's done by a professional sterile environment, the only side effects really that will most likely occur would be the circular bruises from the cups. So that's the end of our presentation. Basically, this is different from a lot of aids in that it's not just like a performance enhancer thing. This is really a pain management and treatment thing for therapy and stuff. But I know Maddie's used it and I've done it a couple times. So I think it's helped and it's actually kind of nice. Like it hurts a little bit because it's kind of feels like you're getting pinched, but I think it's a good treatment and it can be very helpful for people with back pain and stuff like that.